Hello. Welcome to a brand new medical surgical lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please have your notebook ready, your notes, and your textbook so you can follow along with this lesson. Thank you for joining me with this lesson. This lesson covers a quick review of the anatomy and physiology of the neurological system. We will focus on assessment methods, age-related changes, key assessment parameters, and RN diagnostic test assessment for this system. Major divisions of the nervous system are the central nervous system, which is the brain and the spinal cord, and the peripheral nervous system, which includes the 12 pairs of the cranial nerves and the 31 pairs of the spinal nerves and the autonomic nervous system. By the end of this lesson, you should be able to identify changes that occur in the system due to aging process. You should be able to explain factors that place the patient at risk for neurologic problems. You should be able to walk patients through the diagnostic tests used to evaluate patients that present with neurological problems, and you should be able to describe the nurse's role in caring for patients before, during, and after diagnostic tests for the nervous system. Now, let's do a very quick overview of the nervous system cells, structure, and their functions. So we have a picture of a neuron here. We know that we have two types of neurons. We have motor neurons for movement and mobility, and we have sensory neurons for sensation. Each neuron has a cell body as illustrated here, and it has dendrites and an axon. And we remember that afferent neurons are sensory and they send impulses from the central nervous system to the central nervous system away from the peripheral nervous system. Efferent neurons are motor and they carry signals from the central nervous system to cells in the peripheral nervous system. Let's talk about the myelin sheath. As noted here, we have a myelinated axon here and we have unmyelinated axon here, as we can see. Myelin sheath is a lipid covering. Myelinated axons appear whitish, which is what we call white matter, or non-myelinated axons appear grayish, and we call that gray matter. A little more on myelinated axon. We know myelinated axons have gaps in the myelin sheath that we call the nodes of Ranvier. The enlarged distal end of each axon is called the synaptic or terminal knob, and each neuron produces specific neurotransmitters. Let's look at another picture of the nodes of Ranvier. And each neuron produces a specific neurotransmitter. Examples are acetylcholine and serotonin, and our synapses are transmit impulses to intended destinations. So we have two types of synapses happening. We have neuron to neuron synapses and we have neuron to muscle or gland synapses that are happening. Let's also mention the cells of the nervous system. We have neuroglial cells. They vary in shape and sizes. The four types that we want to emphasize are the astroglial cells and the ependymal cells, the oligodendrocytes, and the microglial cells. Neuroglial cells are part of what forms the blood-brain barrier, and they help regulate cerebrospinal fluid. Now, let us take time to review parts of the brain and the structure and function of the central nervous system. The central nervous system is composed of the brain, which directs the regulation and function of the nervous system and other body systems, and the spinal cord, which initiates reflex activity and transmits impulses to and from the brain. Let's talk about the brain in a little bit more detail. We're going to talk about the meninges. If you remember, the meninges are what protects the brain and the spinal cord. In the first outer layer, the tough layer, is the dura mater. The space above the dura mater is going to be called the epidural space. So if a patient has an epidural bleed, it's going to be above the dura mater. So there it is in blue in this picture, the top blue layer, that's the dura mater. It is tough, outside layer. The subdura space is going to be right below the dura mater. that's going to be a subdural space. So if a patient has a subdural hematoma, it would be located in this place right here. The next layer is the arachnoid matter. If you notice, this is pointed out right here, the arachnoid matter. In the arachnoid matter is the middle layer. Underneath the arachnoid matter is going to be a subarachnoid space. If a patient has a subarachnoid hemorrhage, it will be located in the below the arachnoid space. And then, of course, the inner layer is going to be the pia mater. Okay, so the next thing we want to talk about is the tentorium. And the tentorium is between the cerebral hemispheres and the cerebellum. It prevents forceful transmission from one hemisphere to the next, and it protects the lower brainstem when the brain experiences trauma. So also, the tentorium can be used to locate where lesions are in the brain. So you may read a report that says there's a supratentorial lesion. Supratentorium would be above the tentorium, located right here. And infratentorium will be below the tentorium, as indicated here. Okay, let's talk a little bit more about parts of the brain. The parts of the brain we want to talk about, the three main parts. We want to talk about the brainstem, and we want to talk about the cerebellum, and we want to talk about the cerebrum, the forebrain. The brainstem is there for life support and basic movement, the cerebellum being for coordination and functionality of muscles, and the forebrain right here is the most advanced and evolutionized part of the brain, divided into the diencephalon, which includes the thalamus, the hypothalamus, and epithalamus, and the cerebrum, which is the largest part, controlling intelligence, creativity, and memory. Remember that the brain, cerebrum, has the right and left hemispheres, and cerebral cortex is the incoming infocenter with 4 lobes. Let's look at the first picture we talked about, and we'll talk about the lobes of the brain here. We have the frontal lobe located right here. We have the parietal lobe here on the side and indicated in yellow in this picture, and we have the temporal lobe indicated in purple. Of course, it's not purple in the real life. And then we have the occipital lobe in blue right here. Okay, the frontal lobe has motor cortex, and it's where the speech areas, the Broca's area, and Wernicke's area are located. These are significant, and when you start talking about patients with aphasia. Now, let's do a quick reminder on brain circulation. We remember that brain circulation is going to start at the carotids here, the carotids and the vertebral arteries. So the carotids and the vertebral is where it's going to start. And the internal carotids are going to branch into the anterior cerebral artery, the ACA, and the middle cerebral artery. And these two posterior cerebrals become the basilar artery, then divide into posterior cerebral arteries. Anterior, middle, and posterior cerebral arteries are what form the circle of Willis right here. Blood flow interruption to any of these areas ends up with deficit. We know that the anterior cerebral artery supplies the midline aspect of that area, and the posterior cerebral artery supplies the mid-temporal and back region and the occipital lobe and the brain stem. Let's remember about the blood-brain barrier. It exists because the endothelial cells of the cerebral capillaries are joined tightly together. That keeps the substances in the brain separate from the substances in the bloodstream, out of the cerebrospinal circulation and out of brain tissue. Substances that can pass through the blood-brain barrier include oxygen, glucose, carbon dioxide, alcohol, anesthetics, and water. Large molecules such as albumin, or any substance really that's bound to albumin, and many antibiotics are prevented from crossing the blood-brain barrier. The cerebrospinal fluid cushions the brain and the spinal cord and bathes all of the brain tissues. Let's now do a quick overview of what's going on inside the spinal cord. Here's a picture right here. We know that the spinal cord controls body movement, mobility, it regulates organ function, processes sensory information from the extremities, the trunk, and the many internal organs, and transmits information to and from the brain. We know that it contains this edge-shaped gray matter, which is marked brown in this picture, and it is surrounded by white matter, and the white matter is divided into posterior, anterior, and lateral columns. Okay. Ascending tracts. Let's talk a little bit about the ascending tracts. The ascending tracts originate from the spinal cord and end in the brain. And three groups of ascending tracts I want to talk about that are important in understanding the patient with neurological spinal problems and spinal thalamic tracts. And we have the spinal cerebellar tracts, and we also have the posterior white columns that I want to mention. And the descending tracts begin in the brain and end in the spinal cord. The descending tracts are the major descending tracts of importance for understanding neurological problems are the lateral corticospinal tracts and the pyramidal tracts. And those are the things you need to know. Let's now quickly review the peripheral nervous system. It is composed of 12 pairs of cranial nerves, 31 pairs of spinal nerves. When we talk about the 31 pairs of spinal nerves, we're talking about the 8 cervical, the 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal nerve. And the autonomic nervous system is also part of the peripheral nervous system. We'll talk about that in great detail on the next slide. Each nerve is responsible for different muscle intervention and sensory reception of a given area in the body. And the cervical and thoracic nerves are relatively close to their areas of responsibility. The sacrospinal nerves are distant to theirs because the spinal cord ends between L1 and L2. The axons of the lumbar and sacral cord extend downward before exiting at the appropriate intervertebral foramen. Okay, dermatomes. Dermatomes represent sensory input from spinal nerves to specific areas of the skin. For example, the patient with an injury to cervical spinal nerves C6 and C7 has sensory changes in the thumb and in the index finger, in the middle finger, and the pain and the back of, and the palm of the back of the hand. Let's now quickly review the autonomic nervous system. We know that the autonomic nervous system is further subdivided into the sympathetic nervous system, fight or flight, or the parasympathetic nervous system. We know that the sympathetic nervous system stimulates functions of the body needed for fight or flight, example heart and respiratory rate, and it also inhibits those functions that are not needed. The parasympathetic cells originate in the gray matter of the sacral area of the spinal cord and in portions of the cranial nerves. The parasympathetic nervous system can slow body functions when needed. Parasympathetic fibers to the organs have sensory ability in addition to motor function. It is furthermore important to highlight neurological changes that may be associated with aging. They often affect mobility and sensation. Motor changes in late adulthood can cause patients to be slower and have a decreased response time, and may also cause decrease in sensation. Any problems with that affecting the nerves, the bones, the muscles, and joints also affect motor and therefore may affect ADL ability. Sensory changes in older adults can also affect activities of daily living. We know that pupil size decreases, and we know that there's a restriction of how much light enters the eye, and vision may be impaired. Touch sensation may also decrease, and by sense of vibration to the ankles and feet may also decrease. The older adult is at an increased risk for falls, and also hearing high-pitched sounds may be impaired. When assessing a patient, you want to begin with a patient history and you want to observe the patient throughout the assessment process. You want to note the patient's appearance and you want to assess their speech, their affect, and their motor function. As far as history taking, you want to ask them about medical history that may determine a family history of stroke or any neurological problems. Any problems with ADLs need to be evaluated. You want to ask any diseases that may have a genetic influence or cultural predisposition. You want to assess a patient's memory because loss of memory, you want to check recent memory and you want to check long-term memory. You want to assess mental status changes in the patient that include orientation. In the physical assessment, it's important to establish baseline data on your neurological patients. You need to be able to compare these baseline with any changes, and you want to be able to tell differences between the right side of the body and the left side of the body. You want to tell differences in the upper extremities and the lower extremities. It's important that a nurse that's doing a neurological assessment is very organized in doing the head to toe and checking the mental status changes. And you want to make sure that you're observing the patient's responsiveness and awareness. You also want to make sure that you're noting change in level of consciousness. Let's remember that a change in LOC is the first indication that central neurologic function is declining. So a change in LOC is the first indication that we may have a decline in the central neurologic function of a patient. You want to evaluate patients' abilities, gait, balance, coordination. You want to test the cranial nerves and see if there's any issues. You want to assess sensory function for patients, including pain, touch, deep sensation, and proprioception. Throughout the physical assessment, sorry about that, you also want to check reflexes. And I want to talk quickly here about the importance of doing a rapid neurological assessment or a neurocheck. Should be an ongoing part of your assessment, especially if you're taking care of a neurologic patient. Nurses that are doing a neurocheck collect and document data related to LOC for orientation, movement of arms, legs, pupil size, reaction to light. You also want to use the Glasgow Coma Scale. You want to make sure that you note the patient's LOC, and you want to note complaints of headache, restlessness, irritability, unusual quietness, if they have slurred speech, and a change in level of orientation. You also want to note if the patient is having any posturing or any problems. It's important for you to remember that the presentation of a neurologic patient or a patient with neurologic injury is going to vary based on age, gender, mobility, and cognitive impairments that are going on with the patient. Several diagnostic tests may be done in terms of a patient with neurologic problems. It's important that you explain what patients should expect during the diagnostic testing, and you want to provide pre-test and post-test nursing care for these patients. They may do x-rays, cerebral angiography, they may do a CT and an MRI, a PET scan. They may also do an electroencephalography, and they may do a cerebral blood flow test, a lumbar puncture, intracranial hemodynamics. They may do muscle or nerve biopsies, and it's important that you're familiar with the test and you also explain what's going on as far as why the patient is having that test to the patient or significant other. Before an MRI, check the patient for magnetic devices such as a pacemaker, a vascular stent, or implanted pumps. You want to reinforce teaching on the use, especially with patients with memory loss or any neurological impairment. You want to explain why patients should expect before and during the procedure. You want to encourage a patient to receive that's going to receive contrast media, that it's going to be important that they drink plenty of fluids to eliminate that material. And you want to remind patients to move slowly and with caution. after they've had a test. You want to reinforce teaching, especially for patients that are experiencing memory loss. Thank you for listening into this lesson. I hope you enjoyed the review, and it was a quick overview of how to assess the neurological patients. And I also hope you understand the focus on identifying changes that may happen to the system due to the aging process or any other problems. I also hope you understand how to take care of patients throughout the diagnostic tests that may be done through this system. If you have any questions about this lesson or corresponding notes, please feel free to email me. Have a wonderful day.